Thank you, Chairperson. Thank you for giving me opportunity to present this on this podium. It's really wonderful. We really enjoyed yesterday in the Congress. Today, my topic is about the chronic liver diseases and what are the advanced techniques available to do early diagnosis. Liver chronic disease is one of the global problems, and everyone is talking about it because if we don't do early diagnosis, the survival rate is very minimal. Whatever is the predisposing conditions of chronic liver diseases, the pathology remains the same. So if early diagnosis is done on an early stage, we can halt the progression of liver problems like early fibrosis, cirrhosis, and we can help the patient. As I mentioned, there are stages. If there is only less than 5% fat in the liver, it's normal. Anything which is more than 5% of the fat of the liver weight, it is a steatosis. Inflammation of the liver, as we talk about, liver fibrosis, significant fibrosis, and cirrhosis. And of course, cirrhosis with HCC as well. There are different techniques which can help us do early diagnosis. I will start with fibrosis. Of course, there are multimodality approach. We can do CT, MRI, and also ultrasound elastograph, which is acoustic radiation force impulse, which really helps clinicians to do early detection of early fibrosis with some quantification using a normal conventional ultrasound imaging. And of course, last but not least, you can also use contrast imaging to do the liver lesion detection in the liver. Second stage, steatohepatitis, which is a pathological injury. We have lots of amazing serum tests, inflammation, LFT, liver function test available, and also other advanced tests which are available now for steatohepatitis conditions. Where we face difficulty is the screening of fatty liver. It's really difficult because most of the time when patient comes for ultrasound, we see a really bright liver, and sometimes it's not just fatty, it's masked by early fibrosis is masked by a fatty liver, and we are looking at the bright liver with no diaphragm, but in the background there is early fibrosis happening. So we really need a tool which can help clinicians to do early diagnosis of liver fat assessment. Of course, we can do CT, it's wonderful. Liver biopsy is gold standard. Also MRI PDFF, which is a proton density fat fraction, which can be used for the fat assessment. But all these techniques are expensive and not exposed to most of the population. So what we needed was something which is easy to use and affordable for most of the population. And that's where the UDFF technology comes in the picture, which is called ultrasound derived fat fraction. Before I go to UDFF, I would like to mention that of course liver biopsy is a gold standard, but we cannot use it for a screening tool because there is problems like sample errors problems, and you know that it's not very easy to do liver biopsies. Before I go and talk about UDFF, I just want to motivate all the clinicians that before long years we had only 2D imaging on ultrasound, but we did still do the diagnosis for cirrhosis, looking at the liver, irregular borders, ascites, and then we got introduction to color Doppler, and we really enjoyed using color Doppler. It gave a lot more information of feeding vessels and the vascularity. But also, I would like to encourage and say that elastography is going to be one of the tools which will help for early detection of not only liver pathology, but also using it for lesions to see if it is hard or soft, which will help definitely again to do early diagnosis. Detect earlier. Why it is important in the liver? As I mentioned before, liver problems are really silent. It's a silent killer. If we don't detect on a very early stage, survival rate is really poor. MRI is one of the technique, which is MRI PDFF, which can be used to do fat assessment in the liver. for an early diagnosis, but as I mentioned, it's expensive. Not everyone can get access, time consuming, and sometimes it needs sedation also in some cases. As a result, there are scientific companies who have decided to develop something which is really easy to use. And I come back to my point, which is ultrasound-derived fat fraction. This technique is used to assess the fat in the liver on a very early stage. And how it does, on this slide I would like to show you, because anything which is something new, you want it fast and easy to report. So as you can see on the screen, you just press one click on the machines, on ultrasound machines, and you get the information of 15 numbers, meaning you can have 15 samples there. And also if you see here, you have two things, UDFF in percentage, which is very easy to report. Anything which is less than 5% fat, it's a normal liver. And then you go mild, moderate, and severe. So just one click, which takes 1 to 3 seconds of your time, and you can really help the patient. I would like to show you one study which will give, because when we talk to clinician, it's really important. Clinical validation is the most important topic. Once you have clinical validation, you get a lot of confidence to use anything which is new. So we have done a clinical correlation between ultrasound UDFF and PDFF. I have these 3 case studies here. The patient has done a UDFF, which shows 2%, which is a normal liver, and also same patient MRI is done. With PDFF, it's 1.5%, which is very close to each other. Second patient, 17% UDFF, which is a mild fatty, and also MRI shown results, which is very close, again 17.6%. The third case is 26% UDFF, and again you can see on the PDFF is 26%, 26.5%, which is a moderate fatty liver. Just again, I would like to show you on this video that it's really easy to use. You have a sample box, press one button, and you get the reports immediately. This is one of the publication which is recently published, I think last week, which is really nice, which has done a correlation between MRI PDFF and ultrasound UDFF. Also, I mainly talked about the early detection of fat, but it's already, for last 6 years, we are already using techniques called ARFI, acoustic radiation force impulse, which is clinically proven now, and there are cutoff values for absent or mild fibrosis, a significant fibrosis, and severe fibrosis and cirrhosis. These are really sensitive numbers, and definitely clinician can trust this, because a lot of studies, I would say, if I give a number, more than 400 publications are done with biopsy correlation. So it's really strong and sensitive numbers which can be used to detect the early fibrosis. This is another paper which I would like to share. If you would like to take a screenshot, it's really nice. If you go through it, it gives you more information about what I said about early detection of liver fibrosis. Again, some different vendors will have different numbers, but what are the more clinical validations done, you will definitely go with that. There are different techniques other than RFI technology, which is transient elastography, which is one of the very good technology as well, but it's a blind technique. You don't know from where you're taking the samples. So that's where, again, ultrasound plays a very, very important role, and you can use your standalone ultrasound system with this additional tool to detect early liver problems. Thank you very much.
Thank you, Mayuri, for an excellent lecture.